Hi, everyone. I'm Jen Rubin. I'm from Chicago. Next slide. So just those of you who are not familiar with Lurie Children's Hospital, we opened up a $900 million new children's hospital in June of 2012. It was formerly Children's Memorial Hospital. It's downtown now, located on the campus adjacent to Northwestern Hospital, the Women's Hospital affiliated with Northwestern, and right next to the new Shirley Ryan Ability Lab, which is the #1 rehab hospital in the country. Next. So, our center is similar to some of the others you've heard from. We believe that patients with leukodystrophies deserve compassionate, cutting-edge care at all stages of their disease, and treatment is always possible, even when there's no curative therapy. Next. Our leukodystrophy care program consists of the co-directors, myself, and Dr. Burton, who's a geneticist who's primarily still focusing on research and clinical trials. We have our care coordinator, which is Rachel Hickey, a genetic counselor, our nursing support, Lakeisha Green. We have social work support, Sue Shim, and we have palliative care support, Alicia Waldman, who's head of the division. Next slide. And you guys have heard a little bit today about other centers across the country having leukodystrophy, having palliative care involved with leukodystrophy. For those not familiar, I've also done some additional training in pediatric palliative care. It's specialized medical care for anyone living with serious illness. It focuses on providing relief from symptoms and stress of the illness. And the goal is to improve quality of life for both the child and family. The team works with the child's other doctors as an extra layer of support. So palliative care can either come from people practicing, such as myself, primary palliative care, where they're practicing palliative care throughout their clinic, or subspecialty palliative care done by our palliative care specialists who are fellowship trained. It's family centered, and it helps with communication and coordination of care. Next slide. As far as the progress of our clinic over time, our inaugural multidisciplinary leukodystrophy care program was in October of 2016. It was initially quarterly half-day clinic, and beginning last June, we have a full-day clinic once a month, and we have, as many other centers, telemedicine consultations and visits available as well. We are the referral center for babies identified in Illinois via newborn state screening with Krabbe disease or X-linked adrenal leukodystrophy. And as you can imagine, with X-linked adrenal leukodystrophy, we are now getting referred siblings of babies identified via newborn screen. And we've transplanted several infants and children with leukodystrophies. Next slide. As other centers, we are involved in clinical research, and we are a site for several clinical trials. Next slide. We have seen and take care of kids with a variety of leukodystrophies that are listed there. As I said before, the Krabbe disease and X-linked adrenal leukodystrophy are now in the newborn screen in Illinois. And we have transplanted patients with Krabbe disease, metachromatic leukodystrophy, and X-linked ALD. Next. So here's how to get in touch with us. Appointments are available urgently for patients in need of initial evaluation. Our clinical coordinator is Rachel Hickey, so she is our genetic counselor who has extensive knowledge in leukodystrophies and genetic testing. And then just for contact information, both our genetics and the Division of Neurology are contact points. Thank you.